Thank you, Madam MC. Yang berhormat Datuk Haji Yaakob Khan, Minister of Science, Technology and Innovation Sabah. Yang berbahagia Profesor Datuk Dr. Taufik Yap Yun Hin, Vice Chancellor of University Malaysia Sabah, Principal Officers of University Malaysia Sabah, Associate Professor Dr. Jidon Adrian Janaun, Director of Innovation and Commercialization Management Center, Associate Professor Dr. Homa Devi Anak Perempuan Raman, Acting Director for Research Management Center UMS, Deans, Directors, Head of Department, Presenter and Participant, Representative from the media, ladies and gentlemen. Good morning, selamat pagi, ketobian nodong subab, and salam sejahtera to all of you. I'm very happy and would like to congratulate the organizer for successfully organizing this first UMS Colloquium on Fundamental Research and Application. I know that this conference is supposed to be organized last year, but postponed because of the pandemic. This is the table of content for my presentation today. I will start with the introduction and background information on my topic. When I was asked to choose a topic on something related to COVID-19 and also for research, I thought of the group of people who may be the most disadvantaged during this pandemic, and also a real concern for many local Sabahan. In Sabah, the topic of migrant has always been heavily debated, especially the issue of undocumented migrants or the voiceless group. It is always a huge concern for many Sabahan residents. And when I say a voiceless of Sabah, I actually meant the undocumented migrant or irregular or illegal migrants. Is a person who, owing to unauthorized entry, breach of a condition of entry, or the expiry of his or her visa, lacks legal status in a transit or host country. This definition covers those persons who have entered a transit or host country lawfully, but have stayed for longer period than authorized or subsequently taken unauthorized employment. The debate about undocumented migrant, many locals are not tolerant to this group of people, regardless how long they've been in Sabah. This local feels the migrants are competing for job and introducing unwanted social ills into the Sabah society. On the other hand, there are also local human rights activists and the United Nations Sustainable Goal that says leave no one behind, call for a fair treatment to the undocumented migrant. Let me talk a little bit about the history of migration in Sabah. It started during the colonial period in between 1824 to 1957, where the Filipino and Indonesian migrants were employed as plantation estate workers. And the civil war in late 1960s in southern Philippines caused many to seek refuge in Sabah. In 1971, the implementation of the new economic policy brings many more Filipino and Indonesian migrants. They're entering and brought to do the 3D jobs, dirty, difficult, dangerous, in the construction and service sector. So let me talk about the current situation of the undocumented migrant in Sabah. The World Bank reports in 2019 says that there are between 2.96 to 3.26 million migrant workers in Malaysia in 2017. These include 1.23 to 1.46 million undocumented migrant workers. Sabah has the highest number of illegal immigrants, estimated around 800,000 to 1.2 million. Of this estimate, Tawau has the highest number at 180,000, followed by Sandakan and Kota Kinabalu. The two predominant migrants are Indonesian, 85%, and Filipinos, 15%. This is not surprising given the close geographical proximity between Sabah, southern Philippines, Sulawesi, and North Kalimantan, Indonesia. So this just the map on to show how close is the Philippines, the Kalimantan, Sulawesi to Sabah. The undocumented migrant having an irregular status are at the extreme disadvantage. Insecurities in terms of their employment, income, and restriction to their access to healthcare and education. It's also a barrier to accessing healthcare. There is social stigma, fear of deportation, and there's also lack of awareness of their right and also due related to socioeconomic. The undocumented migrants are also not captured in the national statistic. They are the most under-researched group, making development of intervention specifically targeting them difficult. Their illegal status also caused them to not dare to seek legal redress from any unjust treatment. So the undocumented migrants are at health risk. They are often financially poor, do not practice contraception, no antenatal care, deliver in unsafe environment conducted by untrained birth attendants, and most of the time present late with complication, often with very poor outcome. I cannot talk about undocumented migrant without touching about stateless children or children without documents. These children face multiple forms of discrimination that stem largely from their uncertain or lack of legal status in Malaysia. They have very limited access to healthcare and education. They can be vulnerable to abuse, exploitation, and other violations of their human rights. There are no accurate or reliable figures on the numbers of stateless children, as in the number of stateless persons in Malaysia. This report in the Star in February 2020 caused a huge outcry and mixed response, when a group of children of sea nomad decided to take a dip in a fountain in the middle of Kota Kinabalu city. And of course, created a lot of social media storms. And if you look at it, some people say they're just children enjoying themselves. Stateless children or children without document, actually Malaysia is not a signatory to the United Nations Convention relating to statelessness, but it has adopted the Convention on the Right of the child, which give all children the rights to a legal identity. And Malaysian stateless children is still in legal limbo. There are estimated 150,000 stateless children in Malaysia. To date, there is no definitive solution planned for these children. However, UNICEF has been closely working with the government to ensure the birth of all children are registered, particularly those in rural communities. Let me brag and tell a short story. I became a doctor in 1991, 30 years ago. I worked for 5 years in West Malaysia and the rest 25 years in Sabah. I traveled all over Sabah to provide medical services. I have had many encounters with undocumented migrants during my service. In Duchess of Kent, in Hospital Sandakan, we delivered many undocumented migrants or illegal immigrants. Many of them actually arrive in a bad condition, usually due to hemorrhage or bleeding on the way to the hospital. A few actually died maternal mortality. These pregnant women, they wait in Taganak Island in Philippines. And when they go into labor, then they cross the border. But Taganak Island is 34.5 kilometers from Sandakan. And it will take about 40 minutes on a speedboat. So you can imagine how painful it must be for them in labor and traveling on a speedboat. Yeah. So some of them, in fact, actually deliver in the boat. Sometimes it's a bad weather and there's a lot of problem with that. So it's quite sad to see this situation. Let me move to my next chapter, the impact of COVID-19 to this Voiceless group. Yeah? The United Nations High Commissioner for Refugees came up with a policy recommendation and good practices for the stateless population. Basically, it proposes that all persons should be included in the national response plan accordingly. This is consistent with the United Nations General Secretary urging that government takes human right-oriented responses, which put people at the center. And it again in this document, it states the problem that undocumented migrant faces in this situation during this pandemic. The United Nations High Commissioner for Refugees, the UNHCR, has listed 8 possible ways in which stateless person can be disproportionately impacted by COVID-19. At the time of publication, Malaysia officials have responded to the first list, that is by urging all persons present on the territory to come forward for testing if they show symptoms of COVID-19 and provided assurance that they will not face detention or deportation, regardless of their nationality status or legal resident. I also spoke to people dealing with undocumented, marginalized people. I spoke to the director of Etania School Sabah. Etania Schools provides education for marginalized, undocumented, and stateless children in Sabah. They have about 900 students. I asked the director, Dr. Catherine Ruvai, permission, and she granted me to mention her here. And she also shared the various problems that undocumented people suffered during this COVID-19, such as food insecurity, loss income, loss of work, lack access to medical care, lack of accurate advice on COVID-19, and so on. They listen to hearsay, especially from their native country. They're not taking precaution. Their education is disrupted. They cannot go to school. Online is not practical because many of these undocumented children have no electricity or no internet, or even if they do, they have very intermittent internet connection. The constant EMCO prevent the kids from climbing a hill to get internet. There's also lack of proper nutrition because they don't get their vitamins. At least when they go to school, they are given some vitamins, and they have no money or lack of income to buy nutritious food. Many of these children goes hungry. The fear of authorities is real in the roadblocks or broad barrier hospital. There's also mental health related issue. The poor nutrition causes the new mom to have not enough milk, and they have to go, they ask for milk powder. Dr. Catherine shared to me a Google Drive, and you can have a look at it when you have time, about the effect of this COVID-19 to undocumented children or undocumented migrants. There are a few civil society that are giving assistance to undocumented migrants. Advocate for non-discrimination and access to knowledge, ANAK, a grassroots community-based organization founded by author of this paper, Mary Ann Baltazar. They serve stateless, undocumented, and migrant communities in Sabah. They also answer to UN's call on the lack of information leading to limited awareness of mitigation measure. They produce a number of tailored and targeted public health messaging for the undocumented people. And they also contributed in a few commentaries on reaching the stateless, undocumented, and migrant communities during the COVID-19 pandemic. Okay, before I go to the next chapter, let me tell you another sad story. My encounter with undocumented pregnant woman that came to the ER, and when she came to the ER, the body of the baby is already out, but the head is stuck inside. The story is that she was running away from being captured by the authorities. So she was in the jungle and she went into labor. Unfortunately, the baby couldn't come out. And when she arrived at the ER, the body of the baby is already blue and is hardly moving. We managed to deliver the baby vaginally, but they wouldn't want admission. They took the baby and left. But the baby was still alive, but can see that it's really in bad condition and most likely will not survive. So there's some very sad situation for the undocumented migrant. So, okay, let me move to the next chapter. Over the years, there have been proposed and implemented solution for this problem of undocumented migrant in Malaysia, particularly in Sabah. The Malaysian government acknowledges the problem related to undocumented migrants. There have been many significant efforts to curb this problem. The Sabah Federal Special Task Force was formed in 1989 to handle and control issues related to migrants. There is also an inquiry on the immigrants in Sabah, and this was done in 2014, the report of the Commission of Inquiry on Immigrants in Sabah. It's a long report. There's also a proposal on how to solve this problem. The Ministry of Health enforced that foreign workers in Malaysia must be covered by the hospitalization and surgical scheme for foreign workers in 2011. But as you can see, this also for documented migrant, not for the undocumented. And over the years, a variety of documents supposed to be part of solution, but heavily debated. This is supposed to register the migrants. There is the IMM 13 for refugees. There's this card burung-burung, and there's also this census certificate. In March 2013, the Eastern Sabah Security Command was formed. It's supposed to be a security that covers an area of 1,400 kilometers from east coast of Sabah in Kudat to Tawau. There's an ongoing deportation for the undocumented migrants, and there's also a temporary detention center. That also raises a lot of questions, but I will not go in detail about this here. Yeah. Okay, we started vaccinating illegal or undocumented migrant. So just a very quick story, another story of my encounter with a pregnant undocumented migrant. This lady never attended any antenatal clinic during her pregnancy. She attempted to deliver at home. Unfortunately, the baby is actually abnormal. The fetus is a hydrocephalic fetus, huge head, so cannot come out. And the woman was brought to the emergency room, unconscious. And we did an operation for her. The uterus actually was ruptured inside, and the baby was in the abdomen. And we have to remove the baby, of course, is not alive. Then we have to remove the uterus. Her hemoglobin was only 4 grams%. Yeah. And there was no blood during that time, and no ICU bed. And we put her in the regular ward. Miraculously, she survived and went home. We always discuss this among us in the hospital. The illegal migrants or the undocumented, they are actually very tough, strong, and resilient. If that patient was a local, she wouldn't have survived the incident, you know. And sometimes it helps us with our feel less guilty when we are in a situation when we have to decide, when there's only one ICU bed or 1 pint of blood, and there are 2 patients, 1 local and 1 illegal. So sometimes we have to choose. This is in some area in Sabah. All right, this is the most important slide of all. What's the university role? Yeah, the university role. We want solution. We want solution related to the undocumented migrants, the stateless people, especially children. University is on a neutral ground, and our role is supposed to find solution, contribute to improve quality of life, create wealth, and build the nation through our research or contribution to the society. Currently, the debate on these undocumented migrant stateless children is causing a lot of unhappiness. There's also a lot of suffering, not only local, but also the undocumented migrant. There's a lot of apprehension and distrust. Yeah. So we need to find solution. We need to contribute to improve the quality of life. We need to create wealth, and we need to contribute to build the nation. So what is our research agenda? So looking through all the data that is available, we need more research on why is local apprehension towards these undocumented migrants. There's a lot of hear and say. We need research proven, We need more research or a larger scale study to obtain comprehensive baseline data on migrants. We need to find the link between migrants and increased social ills and diseases. It needs to be research proven. Evidence-based, appropriate, and targeted intervention can be developed to improve relationship between local and undocumented migrants. So looking at all this, the research have to be multidisciplinary. It needs to involve all quarters. And to address this issue, to find solution, we know that the public sector, the private sector, and civil society need to work together to address this issue, to find solution. So I think that's all. It's a little bit difficult talking, doing this presentation. Anyway, I hope you all enjoyed it. Enjoyed the presentation. Thank you. Terima kasih, ketahuadan to all of you. And this just is my sources of presentation. Thank you again.